Thanks, Wayne. In Democracy 2014 this noon, our congressional delegates here in Florida are gearing up for the next legislative session right now. We want to welcome Congressman Dennis Ross of Florida's 15th District to talk about some of the legislative accomplishments over the past session and legislation he is supporting this year. Thanks for joining us, Congressman.
Thank you.
Appreciate it. First of all, of course, your office works with constituents, helping them deal with federal agencies like the VA. Been in the news a lot lately. Tell us what you're doing to help Florida vets.
Well, you know, the one thing that we do predominantly is work with our veterans, not only in making sure that they get prompt and appropriate medical care and treatment at the Veterans Administration's hospitals, but also to assimilate them back into the work world, to make sure that they have the appropriate rehabilitation, whether it be vocational or physical, so that they're able to perform gainful employment when they return. You know, these are the people that raised their right hand and swore an oath to give the ultimate sacrifice of their lives. They deserve everything that we can give them, not only in terms of health care, but also in terms of disability benefits and in terms of reemployment opportunities, which is why we give them priorities.
And this new health care bill has gone a long way to do that. The Veterans Affairs
Yes,
bill.
it did. In fact, just before we left for the August recess, we passed a bill, and it basically said, look, we understand the mission is to give them prompt and appropriate medical care and treatment. If they can't find a doctor in time at the VA, they can go to a private health care physician. Any willing provider, essentially, who's on the private, who wants to treat them, can do so under the VA now.
Let's talk a little bit about the Affordable Care Act, promised to reduce the cost of health care. What are some of your concerns with that?
Well, I think you're going to see that in Florida especially, the average increase of insurance premiums for health insurance is going to go up by 13% this year. Look, we need to, health care is a big issue, but we also need to make sure we preserve the patient-doctor relationship and that we don't have a bureaucratic organization telling people how they should receive certain types of care. We need to make sure that we have good health benefits. We need to make sure we have competition amongst health insurance companies to provide those benefits and give consumers choices of what type of benefits they want to have and what doctors they can go to.
And quickly, there are some bills stuck in the Senate right now. You say would create jobs, boost the economy? Tell
Absolutely. 355 bills were passed out of the House this year that died in the Senate. Some of these bills would increase the amount of capital that investors could get their hands on to start new businesses, to hire more people, to expand their operations. Look, it is all about private sector jobs. We can't grow this government anymore and expect it to flourish. We've got to invest in our communities. We've got to let capital flow. We've got to let entrepreneurs invent. And some of these bills, if not most of these bills, do just that.
All right, Congressman, thank you very much for joining us today.
Thank you. My pleasure.
Appreciate it. Dia, over to you.